Good morning. Welcome back to the Mountain Morning Show. This morning, I have the pleasure of being here with Beth Armstrong, the Executive Director of the People's Health Clinic. Good morning.
Good morning.
Thank you for joining us this morning. There's always a lot going on there. So I know there's some things you want to talk about specifically this morning. Let's go ahead and dive into that.
All right. Well, I always like to start out whenever, and it's thanking, first of all, Park City TV for allowing us to come on and tell people about what we do at the clinic and who we care for and why we exist. So People's Health Care, I'm sorry, I do that all the time. People's Health Clinic exists to provide health care for the uninsured of Summit and Wasatch County. We take no federal funding, so we depend on a lot of grant writing, some state and local government, but no federal funding. A large amount, up to 15, maybe 18% of our funding comes from patient donations. Oh. So when a patient comes in, they're asked, would you like to make a donation? And if a patient can, they will, because they like to feel like they are giving back and paying for their care. So more than 97% of our patients have at least one job, and most of those have 2 and 3 jobs. So these are not people who, you know, they're hardworking individuals. Yeah. So the way we provide the care for them in town, the way we do is that we share an office with the Summit County Health Department. Mm-hmm. So if you're going out to Round Valley and you are going out towards the hospital, you'll take that left, and we are the first building on the left. We're a nice new silver building, mm-hmm. and we're very lucky to have that space. And whenever we so that gives us the place, the quality part of the healthcare in the facilities. Mm-hmm. And then we have wonderful medical director, Dr. John Hanrahan, who's been with the clinic since its very inception in 1999. Wow. And then we have a physician's assistant, Rochelle Doucette, who comes and she came as a volunteer years ago. She became an employee after that. She was with us a while and left to become a PA, and now is back as our physician assistant and our clinic coordinator. So we're very lucky to have both of those providing care. Mm-hmm. And then we have our volunteer medical force. And we are always looking for volunteers. So if you have no medical experience, we still can use you, because we use volunteers for intake, which is it's an easy thing to teach. We can come and show you how to do it. Absolutely. And just do you take vitals, and then you bring the patient back to their room. If you speak Spanish, we have a real need for interpreters. Mm-hmm. And if you are a medical provider, then anything that you do, almost anything non-emergent we do. So from chiropractor to neurology.
Sure, so anyone could come in and volunteer, and even if it's like 2 hours a week you can give towards the clinic to provide services even, Yeah,
we have some people come in, we have one dentist that comes in once every 6 months. Oh, okay. And we love that. Every little thing we can do fills a need.
Exactly.
We just have gotten some doctors who we realize we don't need them to come in if they just make themselves available for phone consultations. Sure. Which our, Dr. Hanrahan will pick up a phone and call a gastroenterologist and say, I have a patient that's showing these symptoms. And so if you just want to make yourself available for a phone consultation, that's really great.
That's fantastic. Yep. And your Heber branch that happens on Mondays, how's that going?
It's going great. We're open in Heber 9 to 12, and that's for our prenatal clinic, and we're doing really well there. We would like to get, anything that's new, it takes a while to get it rolled out. We would like to have Rochelle start going and seeing patients, but we haven't had that need yet. But as soon as we have that service billed, then she will go and see women who maybe aren't there to see the OB, and they just need a well woman checkup. So she'll be there for that. So she does a lot of that. We also provide a lot of different birth control methods. So if you're needing, if you think that you're not in a place where you want to become pregnant, then you come and see us, and we will talk to you about different forms of birth control.
Wonderful. And is there an update on the Medicare that we were talking about last time you were here?
Yes, exciting news. over the weekend there was a big push. We could not have done this without the volunteer effort, but there was a big push down in Tooele County.
Okay.
And we have reached the $165,000 goal that we were working for. In order for it to go onto the ballot, it needed 113,000 plus signatures. And we get the 165 as our goal because some of those signatures, as the people go through and audit them, they find some that are not allowed and they'll take those out.
Okay.
So they really do look at them, and especially on Medicaid expansion, they're going to be really scrutinizing it. So we wanted to make sure that we had a nice buffer. Mm-hmm. So we have reached that $165,000 watermark. So I think that chances are very good that we'll get it on the ballot November 18th.
Awesome.
Yeah. And it's important. There's still, even though the ACA came in and did cover a lot of people who before didn't have insurance, there is a dollar amount threshold where you are required to have ACA. If you are under that threshold, and about 200,000 people in the state of Utah do fall under that threshold but make too much to qualify for Medicaid, then they are left uninsured. Wow. We see a lot of those people, but we can't see. There are 7 free clinics in the state of Utah from Moab to Ogden. But we can't cover all of those. So we really needed that assistance. And with this Medicaid expansion, if it gets on the ballot and it passes, which, I think the good people of Utah are going to decide that this is, it's worth 4 cents for every $20 of non-food items you spend. Yeah. So if you go to to go see a movie and have a $20 movie ticket, it'll cost you an extra 4 cents. To ensure
not too painful, right?
You know what? I think I'd actually pay 10 cents.
Exactly.
Yeah.
Can you tell the viewers, especially if they're interested in your services, the website again and the number, and then that way they know where to go to find you?
Perfect. We are peopleshealthclinic.org. Okay. And then go there. You can register for our events upcoming, which is Walk and Wine for Women's Health is our next fun event, and that's June 24th, and it's just 350 women gathering on the mountain to hike, and then we come in and have a nice lunch at Stein Eriksen Lodge.
Oh,
and we have a speaker this year, it's Shannon Barkey, so she will entertain us. I'm sure you know Shannon, and she is hysterical.
Wonderful.
And she has a great message. Then if they would like to call and make an appointment, you can walk in, but we really prefer, it makes it easier for everybody if you make an appointment, and that's 435-333-1850.
Thank you so much, Beth Armstrong, the Executive Director of People's Health Clinic. Don't go away, there's much more to come on the Mountain Morning Show.